Last hour, we heard from a state doctor about their strategy for testing patients.
Yeah, reporter Jason Stujanki joins us live right now. And Jason, testing is such an important topic. I mean, without it, we don't know if the number of cases we're seeing are accurate.
Yeah, Susanna, that's right. And you want to not just track it, but you want to use that information to obviously pick up on any patterns with the disease. So the state doctor, the state epidemiologist, Dr. Zach Moore, he was very clear about this. He didn't sugarcoat it. He said, we're at the very beginning of this. It's a very new virus. Everything's evolving rapidly. He said that things are, and these are his words, ramping up. He said doctors refer to this as the acceleration phase. So obviously we're still going up. We're not plateaued yet. Who knows how long that will take. But he said because it's a new virus, because things are changing so quickly, and because we're trying to get a handle on this, the state is starting to track it a few different ways. It uses the flu as a model, so that's what they're basing a lot of their strategy on. And there are really three things I took away from it, three different techniques they're using. They're going to be compiling lab results. That's the big obvious one, but they also want to gather information from hospitals about people who come in, what symptoms they're seeing. And they also want to look at demographics like where patients live and how old they are.
Laboratory confirmed case counts are never the whole picture. They're important to track, but people need to realize that this applies to them, whether or not there's a case that's been laboratory confirmed where they live.
And the big problem with any kind of scientific work like this is it's so hard to capture every single patient. You have to think there are a lot of patients who go to the doctor, there are a lot who get caught up in the system in a good way, but there are also a lot of patients who may not really be showing any symptoms. They may not realize they're sick, or they may realize they're sick and decide not to go to the doctor. So the state's always trying to find a better way, Damani, to pick up on those people so you get a very accurate count.